Uncomplicated pediatric cataracts with high astigmatism are itself quite a task to handle. Now here is one of the first few cases to be implanting a SMART TORIC IOL in a child with a complex cataract even with a posterior capsular defect and high astigmatism. And this is what would be described in the video, Tackling the Curve. So coming to the case, a 10-year-old girl presented to us with a visual acuity of counter fingers 1 meter in her left eye, a partially absorbed cataract, anterior capsular wrinkling, posterior capsular plaque with a high corneal astigmatism of 6 diopters. Now what we've got is a complex cataract and an anticipated posterior capsular dehiscence. And this, with the aim of implanting a premium IOL, surely demands the right treatment approach. Pre-operatively, after affirming a normal B-scan, astigmatism management was about choosing a toric IOL over a monofocal IOL owing to the high astigmatism. And intraoperatively, the goal was to meticulously handle the complex cataract, simultaneously maintaining capsular integrity to have a successful in-the-bag implantation of the envisioned IOL. The next step is toric IOL customization, which is about the right patient and IOL selection, and also about how and why the customization is done. So here, the first step is to ensure that the child has regular astigmatism. Then, it's IOL selection. We chose a plate haptic design IOL, keeping in mind the rotational stability. Now going into the details of how to obtain the toric IOL, keratometry and topography values are obtained. These values, along with the surgically induced astigmatism, are entered into the toric IOL calculator, which gives the desired dioptric power of the intraocular lens. Now this makes us choose a customized SMART TORIC IOL, as the regular toric IOLs available in the market only correct 6 diopters of astigmatism in the IOL plane, but we needed almost 8.5 diopters in our case. And this IOL is customized according to every patient, thus giving a toric aspheric optic, customized optic size, overall length, plate haptic design with anti-rotational haptic pads, and a predictable refractive outcome. Why is the SMART IOL called SMART? It already incorporates the astigmatic correction smartly in the desired axis. Hence, simply placing it in the 0 to 180 degree axis serves the purpose and avoids any excessive rotation in the bag. It's ideal in our case where we have a compromised posterior capsule. Now that we have the SMART TORIC IOL in hand, we would be taking you through the surgical steps. The initial 0 to 180 degree reference marking is being done. Intraoperatively, the same horizontal marking is reconfirmed. Now, keeping in mind the wrinkled nature of the anterior capsule, for capsular excess, trypan blow used, and the trick is to carefully obtain a small sized excess due to the wrinkled capsule and then to enlarge it with a micro excess forceps and scissors. Then, a good 360 degree hydrodissection is done for the remnants in the equatorial plane. The existent posterior capsular plaque was carefully removed. Seen here now is the capsular dehiscence. And an anterior vitrectomy was done in the area of the pre-existing posterior capsular dehiscence, and the endoilluminator was used to notice the fibrotic edges of the defect. The next crucial step is IOL implantation, and the trick here is to first adjust the IOL along the markings and then implant it at the level just beneath the anterior capsule, nudging only the haptics and not dipping the IOL against the posterior capsule. Now, this SMART TORIC IOL with plate haptics needs minimal rotation and manipulation in the bag, thus avoiding unnecessary pressure on the existing dehiscence. At the final follow-up, the intraocular lens is well aligned, giving an unaided vision of 6/9, hence tackling the curve. To conclude, a SMART TORIC IOL can be aimed even in a complex pediatric cataract case with capsular defects and is a safe and effective option to provide optimal long-term visual outcomes.